Comprehensive assessment of the continence domain in CHC assessment. What is the individual's continence status? Are they continent, occasionally incontinent, or fully incontinent? If they are incontinent, is this of urine, feces, or both? Does their continence status fluctuate, or is it consistently the same? Do they experience urgency, frequency, or any other difficulties with bladder or bowel control? Do they require the use of incontinence products such as pads, pull-ups, or protective bedding? If incontinence products are used, what type are they? How often are they changed? And who assists with this if needed? Are they able to access and use the toilet or commode independently? If assistance is required for toileting, what level of support is needed, e.g. verbal prompting, physical assistance, full transfer support? Do they require a scheduled toileting routine or reminders to maintain continence? Do they experience episodes of loose stools or diarrhea? If so, how frequently do these occur? If loose stools occur, are there any identified triggers such as diet, medication, or underlying medical conditions? Do they experience constipation? If so, how often does it occur, and what interventions are in place to manage it? If constipation is present, does it cause any significant discomfort, bloating, or changes in appetite? Do they require laxatives to maintain regular bowel movements? If laxatives are used, are they taken regularly or on an as-needed basis? What type of laxatives are required, e.g., oral stool softeners, suppositories, enemas? And how frequently are they administered? Do they require manual bowel evacuations? If so, how often does this occur, and who performs this procedure? Do they have a urinary catheter in situ, such as a urethral or suprapubic catheter? If they have a catheter, is it part of a routine care plan, or does it involve complex management? How often is the catheter changed, and who is responsible for changing it? Do they require regular bladder washouts? And if so, how frequently? Have they experienced recurrent urinary tract infections, UTIs? If UTIs occur, how frequently do they happen? And are there any known contributing factors? What treatment is required for UTIs? And do they generally respond well to prescribed treatments? Have they required hospitalization or specialist intervention due to severe or recurrent UTIs? Do they have a stoma in place, such as a colostomy, ileostomy, or urostomy? If a stoma is present, what type of care is required to maintain it, and who is responsible for this care? Is continence care problematic in any way? And if so, what specific challenges are faced? If continence care is problematic, does this impact hygiene, comfort, skin integrity, or overall quality of life? Have there been any issues such as skin breakdown, pressure ulcers, or infections related to incontinence? Are there specific interventions in place to prevent skin irritation, such as barrier creams or regular hygiene routines? Are any specialists involved in managing continence care, such as a continence nurse, district nurse, urologist, or gastroenterologist? What level of monitoring and assessment is required to ensure appropriate continence management? Are continence assessments enhance continence care? Are continence-related interventions aligned with the individual's overall health and care needs? Please share your thoughts in the comment section below.